House Leader of the Official Opposition.
Thank you, Mr. Speaker. Well, the Thompson Region Family Obstetrics Clinic, which delivers 60% of all babies born each month in Kamloops, has announced that they're not taking any new patients after July 31st, effectively implementing a permanent closure. Now, Mr. Speaker, this is a dire situation, and you know it is when over half of the pregnant women in Kamloops, a city of 110,000, cannot access the prenatal care and the obstetrics care that they need. And this crisis is further complicated by the fact that 2 in 5 Kamloopsians, or 50,000 people, do not have access to a family doctor. It's unacceptable that these women are told to go to the overcrowded ER for even the most basic tests. It's unacceptable that many are left to scramble trying to access prenatal care from as far away as Prince George and Abbotsford. It's unacceptable that many of these women and their partners are having to face a decision of possibly moving out of Kamloops, leaving their jobs, in order to access basic care that should be available in Kamloops. Mr. Speaker, we raised this question 3 months ago in this House, and characteristic of this government, the response was, we're having meetings, we're in discussions. Well, since then, this crisis has gotten worse, and expectant moms are increasingly filled with stress and fear and anxiety. And I want to quote just one. Jenna Duclos interacts with many pregnant women in her role as the Director of Community Services at the YMCA in Kamloops. She hears every day the struggles of these expectant moms. And I quote, "I've met multiple moms who have no care and have had to schedule telehealth virtual doctor's appointments to get referrals for blood tests and ultrasounds. These same women have no idea on a weekly or monthly basis how they're measuring, if a baby is growing appropriately, or if they are missing important tests. They have no one to talk to ask these basic questions. One mom told me she's visited emergency 9 times because of worries about her baby. The inability to have proper care is causing an increase in prenatal anxiety, which will likely cause an increase in postpartum anxiety and depression," end quote. Mr. Speaker, my question is this: how many more expectant moms in Kamloops and the region have to suffer and struggle to receive the basic care that they need before this Premier actually steps up with action to fix this prenatal care crisis in Kamloops today?
Minister of Health.
Well, thank you, Honourable Speaker. And the way I think you resolve issues and you work to improve services is you work with the people who deliver those services, and that's precisely what we're doing in Kamloops. The member will know that the fee-for-service model has proven itself to be ineffective. When I became Minister of Health, our system was overwhelmingly fee-for-service. He'll know that more than 3,000 doctors across BC, including 480 who didn't previously provide family practice, have joined the new payment model. Why was that successful? Because we worked with doctors. We have, Honourable Speaker, led Canada in the recruitment and the hiring of new nurses, Honourable Speaker, a contrary record to the record of the previous government. We've done that by working with nurses and nurse practitioners in the BC Nurses Union and communities, Honourable Speaker. In the case of Kamloops, we are working with doctors. You bet we are, Honourable Speaker, to find and to put in place a permanent solution that it provides maternity care in Kamloops, and we're going to continue to do this work, and I'm confident that we'll be able to resolve this issue.